Hi, our paper in the International Journal of Clinical Practice is a perspective on the topic of blood pressure treatment in elderly patients with type 2 diabetes. What is already known on this topic is that more than 1/4 of all patients with type 2 diabetes in the Netherlands is older than 75 years. Although blood pressure control has undoubtedly proven its benefits in reducing the high cardiovascular risk in patients with type 2 diabetes, it still remains unclear whether hypertension treatment in old age is just as beneficial as in younger patients. We showed in our observational Zodiac 12 study that blood pressure is inversely related to mortality in patients aged older than 75 years. Our perspective aims to get a discussion started on the appropriate target value for systolic blood pressure for patients with type 2 diabetes older than 75 years. We would like to propose the value of 160, and the most important argument why we propose this new value is that the evidence for targeting a systolic blood pressure below 140 is essentially absent for this specific population. There is only one study, a sub-analysis of the advanced study, that investigated the effects of hypertension treatment in type 2 diabetic patients aged older than 75 years. We show in our perspective that the mortality rate in our observational Zodiac study was almost twice as high as the mortality rate in the control arm of the advanced study. These data suggest that the elderly patients included in the advanced study do not represent the general diabetic population. In our opinion, selection bias should be considered more often when translating the results of clinical trials into recommendations for daily practice.